Good evening. I feel honored and privileged to be this year's recipient of the Augusta Stone Award. Volunteering is rewarding work, and oftentimes the feel-good you get from volunteering is its own reward. However, being acknowledged at the chairman's dinner for my contributions to Morristown Memorial Hospital is undeniably the ultimate thank you. My deep appreciation goes to Peter, the foundation board, and staff for this recognition. I am humbled that my name will be added to the list of community leaders who are Augusta Stone recipients. Let me first express my appreciation to my family, who puts up with my hectic schedule. Hospitals love to hold meetings bright and early, 7 a.m., or after work to encourage the doctors to attend. I want to especially thank my husband, Bob, who more often than I care to admit has eaten dinner alone because I was at an evening meeting. At least you're getting a hot meal tonight, honey. Bob has always been there to help me with the glory jobs. He has spent more than his fair share of evenings stuffing envelopes and applying mailing labels. He has acted as bartender at a fundraiser, and he's parked cars in the rain. Thank you, honey. I'm happy to report that volunteerism is hereditary. It has been inherited by my two children, Carrie and Rob, who have spent many an afternoon schlepping items for a fundraiser or providing muscle during a project setup. I even once talked poor Rob into modeling at a Mansion in May fashion show in front of hundreds of women. I still owe you for that one. So those of you who are parents and grandparents, your children and grandchildren are learning from your example of volunteerism and philanthropy. Healthcare was a family business for me. My parents, who I'm so happy are here tonight. My parents met at a hospital. Dad, now retired, was a general surgeon, and Mom was an OR nurse. I am proud to say that my daughter, Carrie, is keeping the family tradition alive. This past May, she received her master's degree in public health from Yale and is now working in New York at NYU Langone Medical Center, and I'm very proud of her and all she has accomplished. I would be remiss if I did not acknowledge my wonderful in-laws, Natalie and Bob Rooke, who have always supported my volunteer efforts and are strong hospital supporters themselves. During each and every fundraiser, they have been my biggest cheerleaders, even when that meant hosting Mansion in May directly across from their home. Nothing like having 20,000 people visiting next door. I started my volunteer career at the hospital working for the Women's Association with my much older sister, Sue. Sue Bruin and I have chaired so many projects and fundraisers together that I can't begin to count them. However, some of my fondest memories will include working shoulder to shoulder with my sister while fundraising for the hospital. We've continued our commitment to the Women's Association for over 20 years, and we're not finished yet. Whether I'm attending a 7:30 a.m. early bird meeting of the Brookfield Society, courtesy of my brother-in-law, Bill Bruin, and chairman, or a meeting of the Women's Health Philanthropy Council held at a much more civilized hour at 9:30 in the morning, thank you, Janet Simon, I am continually impressed with the clinical excellence offered at this hospital, the exceptional medical staff, and the nationally recognized nursing staff only reinforces my decision to volunteer my time and energy to this exemplary medical center. The doctors and nurses who are impassioned by their healing mission inspire me to continue to volunteer. Thank you.